trochanters.
Just like it.
It's just the three boys.
You want to stand by yourself now? No, because you guys are videoing. I could do it for you guys later.
Okay, first AP femur.
14 by.
Alright, we need an AP of the femur all the way from ASIS to patella. That is not going to fit on 17 inches, so we're going to use 2 cassettes to do it. So first we're going to do top of the light field at ASIS, and then to make it an AP, 15 to 20 degree medial rotation. We can do a little bit of collimation there. We can still fit our marker. Buckley's line. Okay, hold your breath, beep. So that's an AP of the proximal femur. And now we've got to get the rest of the femur. I like to put my marker right here at the bottom because I know if it is in the next light, that means I had overlap, right? So now I change my cassette and I'm just going to go down to below his knee. And I'm going to do a little bit less, only 5 degrees on that one. I can even collimate a teeny bit more. Definitely had overlap because my marker's in there. Hold your breath, beep. So that's an AP of the femur from ASIS to 1/2 inch distal apex of the patella. So I know I have the entire femur. Now we just need a lateral of that, so you're going to roll it into your right side. I'm going to have a little bit of bellies there. And then now we're just going to work our way up below the patella. Do a little collimation. If you want to get pretty with your picture, how's that make it pretty? Because this line's now going up. Mm-hmm. It just, yeah, looks a lot prettier.
Long axis.
Mm-hmm. Okay, hold your breath, beep. And now I just want to get the same picture, but the proximal part. So I'm going to find his ASIS over here because it's weird over there.
So for the lateral, you have to cock the tube?
You don't have to. It just looks pretty. You don't have to at all. Right now, do I have all of his femur?
You got
yes.
extra.
Yeah, and there's plenty because I know I have overlap, but look, it just looks pretty to do this when the image comes out with it running down the long axis leg, but no, you don't have to do that. Beep. So just an AP, and then flipped him over into lateral. Okay. Now we've got a pelvis, 14, 17. Okay, 14 by 17. Have our set in this way. All right, central ray is midway between ASIS and pubic symphysis. I'm going to go there. But the cheat is if you just put the top of the light field at crest, bam. Got everything. But to make it a true AP, what do we have to do? Pigeon toes. We're going to spread him out, touch his toes together. Hold your breath, beep. The AP pelvis. Okay, right now his bilateral pubes and ischia are sitting this way, so they're foreshortened. So we want to get our tube perpendicular to that. Since he is a male, 20 to 35. So I'm going to go 30-ish. Coming that way. Our central ray is 2 inches below pubic symphysis. So I'm not going to feel his pubic symphysis. I'm going to feel his trochanter, which is right there, 2 inches below. I like it. And there's your outlet.
It doesn't matter his feet placement.
No, we don't care. We're not even looking at legs on this one. We don't care about his femurs. You're not going to get femur on here. Hold your breath, beep. Now we need an inlet, and for everybody it's 40 degrees. 40. We're going to switch our light field. Yeah, this is the one where the light field looks ginormous. This around. Okay, and central ray here is right on ASIS. There's that one. So you're taking that inlet, that big round circle, and you're making it look like an alien head and really elongating it. Beep. Now we have GA for acetabulum. These are a lot easier to do than to say. Be a little 10 by 8 set. All right, say I want to see his right posterior brim. What position will demonstrate that?
LPO.
LPO, yep. So we're gonna roll up 45 degrees and lay back. All right, we wanna see this brim. So this is his upside. So it doesn't take many moves. So all we're gonna do is be around this. End of the thing. All right, so all we're gonna do is start at ACES, and all it requires is 2 inferior. That's it. To visualize the upside. So this shows the right posterior brim, but this position will also show what over there?
The left anterior.
The left anterior. So if we wanted to see what that looked like, we're going to start at ACES, and we're going to go 2 down, but that's not enough. We also have to go 2 in. Yep. So the same position will demonstrate the right posterior, the left anterior. And if we flipped them over into an RPO, that would be the left posterior and the right anterior. Okay. Routine hip. We do a zillion of these. 12, 10. Okay, AP hip, the central ray is 2 inches below mid-femoral neck. So I'm going to find mid-femoral neck. So I'm going to go 2 in, 3 to 4 down. And then our central ray is 2 inches below that. And then to make it an AP, hold your breath, beep. It's the AP hip. Now we're going to change for the lateral. And you're going to bend this leg up, drop it out 40 to 45 degrees. And this one is directly on mid-femoral, so I'm going to go 1 to 2 in, 3 to 4 down. So if I move up about 2, I'm back on mid-femoral neck. And then everybody will do this for pretty. Looks prettier. Do not have to do it, but it looks much nicer coming down the leg that way. Beep. Okay. Now we've done the AP, and we want to do that modified cleaves, but when I ask him to bend his leg, he says, I'm in pain, I can't do it. I said, okay, then you just lay there and I'll do the work. So we're going to use this, and we're going to pretend like we have a grid cap on here, because we don't have this size of grid cap. So we need to make this parallel to his neck. So his neck sits like this. So this kind of gets jammed up right above his crest, and now my neck is parallel to my IR, which is what we're trying to accomplish. This won't work because there's the neck. It's got to be parallel with it, like that. Now I need to get my CR perpendicular to my IR. Coming over. Sorry. All right. This one's interesting. So now this leg is in the way, it's blocking, so I'm going to hike this leg up and get it up on the tube there. And now you're going to stretch your crunch. All right, this one has no tube angle, so now I need to find mid-femoral. 1 to 2, 3 to 4, that's where I want to be. 1 to 2, 3 to 4, looks like it's hitting there, that is center. Outski again.
Some chairs over here.
All right, everybody go gaze at Alex's crotch.
I've seen it before.
Numerous. Watch that. On the cassette, yeah. Flip it on there.
Kind of like spring.
There you go. So you guys can see. So right now, the neck is what to the IR? Parallel. The CR is what to the neck? Perpendicular. And the CR is what to the IR? Perpendicular. So this is just doing that lateral cleaves when he can't move. This is making it lateral.
Does SID matter on this?
You're trying to get 40? Probably not going to. It's portable. You would never do this. You could do it in an x-ray room. But you're assuming if they come down to the x-ray room, you could do a normal one. Okay, now this leg can't move. Now they're both injured, so he's just laying straight. He just came out of surgery. His feet are taped together like that. He doesn't even know we're here. So now we've got to somehow modify that, which is why we call it the modified axiolateral. And I need exactly 15 degrees on my cassette. Teeny bit more. All right, 15 degrees, and then this is 15 to 20. So you always want to do the 20 so that you can scoop. What I'm trying to do is just bypass this leg and throw this hip onto the image receptor. So I'm going to feel this, 1 to 2, 3 to 4, that's where I want to be. And I'm going to move this, that my cassette is centered to that. Looks good.
We're not gonna worry about the light off the wall.
I did collimate, didn't I, or no? No, I didn't really collimate. So we're trying to pass that left leg and get past that and pretty much hit it right in the noties and grab the hip inside of here and throw it onto there. This is the modified axiolateral. And is my IR parallel to his neck? Yes, my CR is perpendicular to my IR. If my CR is not perpendicular to my IR, what's that bad thing we could get? There's a grid on here. Remember what I said, grid, cut off. Cut off. Remember, you have to be directly perpendicular to it. That's it.
You say that so.
What tube angle you have?
This is a 15, that's 15 to 20. You always want to use the 20 when you're allowed to use 20 because you can scoop better and pass that left leg. With 15, you'd probably be like coming in and hitting it. So if we do 20, we can bypass it and hit there. Yep.
Story.
Now you have